about 3 minutes or so, would you be able to tell me what dental lab has to pair with each model of practice?
Well, I can tell you about our model. Obviously, there's a lot of mill dentists, right? I want to go backwards for a second. The largest lab in the country is Glidewell, and they've actually stopped doing porcelain fused to metal. So I've got to read the Christian article. Thank you for pointing that out. I didn't see it today because I had no time to get to my journals, but they've moved away from it because of a multitude of other issues that happened with porcelain fused to metal. Everything in their lab, for the most part, is mill dentistry. They do some lathe work over cores, but obviously for us, we're doing a lot of mill dentistry, and the labs have been able to adapt with their efficiencies. All right, an artist in MDT that has years of additional training, layering porcelain rather than surface staining, usually not working in production labs. For an office such as ours, we need production labs. All right, but the margins and the patient aesthetic demands, they're achieved, within clinical standards. And again, I have to read the Christian article with regard to margins. We work with large labs because we can negotiate volume pricing with these clinically efficient labs. Our time is a critical component of the picture because we don't want to have remakes, we don't want to have extra visits, but theirs is also. So a big thing with the labs is communication with the lab techs has to be absolutely spot on. When there's a question regarding a particular piece of work, the lab and the treating doctor have to clearly communicate. All right, this makes everything work better. And I think that's a good lead-in because Crown ID is doing that or helping them do that, helping labs and doctors communicate. A lot of labs are already doing this, all right, using a non-digital solution. But communication, everything makes everything go much more smoothly. Without it, a great lab can be a disaster. And we've learned from experience that when our doctors communicate with the tech that's actually working on the case, the results are far superior.
Thank you for that, Rick. Carolina, what about you? What model of dental lab pairs well with your model of practice?
Well, I will not say that a boutique dental office requires a boutique dental lab because I've been there, I've tried it, and it didn't work. I would say that there is no correlation in the price that I charged and the price that I was charged by a dental lab. It took me 15 years of practice to find the dental lab of my dreams. I was in Madrid, they were in Amsterdam, and their quality was impeccable. They were the first one to adopt milling machines, whatever, in Europe. They're very, very advanced. They had nailed their productivity model. However they had done it, I don't know. One thing has to be said is that when I needed aesthetics, when I was doing a single central incisor or 2 anterior teeth, it could not be them. It could not be them. I mean, I needed the ceramist, and ceramists are expensive. Mill dentistry I believe will never be able to cover that aspect of prosthetics. A skilled ceramist is expensive. It requires time for it to be good. So it's expensive, it takes time, and it's good. But you don't necessarily have to pay 250, 350 bucks for a crown. I don't believe in 30 bucks for a crown either. I mean, I don't. I have yet to see the margins of a crown that's costing 30 bucks or 40 bucks. I have never purchased one, so I cannot judge, but belief is free, and I'm free to believe, and I don't believe in crowns costing 30 bucks. I respect too much also the lab technicians' profession. Their profession is undergoing a huge transformation, much bigger than ours. It's been like a bulldozer. I don't know if you use that word in English. It's been like a tank walking into their labs, and having to do crowns for that price is like, what the hell? I mean, they're just working with machines, and their profession is gone. I think something will happen there. I don't think it's fair to them. I had given before.
Rick,